We're here, we're live, and it's time to go. So this is a Thursday night, the night before one of our regular videos gets released. Tomorrow at 4 o'clock, 4 p.m. on a Friday, Pacific time, we will have a video released, and it's going to be, which one is it going to be? I believe it's a shave biopsy, and you probably wonder, well, we've seen lots of shave biopsies. What's different about this one? This one's a little different. Oh, hey, we got some people coming in, so we're going to greet them. We got Sakura. Hello, we're glad to have you here. And those of you who are watching this after the fact, the pre-recorded video, if you want to know how to watch these when they're live, you need to go into your settings, make sure you're subscribed, and hit the little bell icon on our channel in YouTube to get notifications and adjust notifications in your phone or device, whatever, so you be sure that you can see these when they come on. We have a lot of people coming in. We have hello BooBoo Kitty, and we have Fat Man's versus Wild. Hello, hello. And Aldo Majuka. Hello. We have Christy Sipes from Modesto. Yes, we know you've been here before. Good to have you from Modesto, so close by. Miranda is saying hello. I think we have some other. Oh yeah, we have others. And by the way, if the chat gets too busy, just go over the little $ thing and use the super chat to be able to break through. That's always there if you need it. Tammy Pearson. Hello. Claire and Barney Dog. Hi, Doctor. Hey, Claire and Barney Dog. Cheryl McNutt. Hey there, Doctor. Brianna Greenwald, hello. Jennifer Lehman, or Lehman. Hey, Dr. Laugh from Ottawa, Canada. Jennifer, are you Dr. Laugh? Because I hate to say this, but I don't know that I've heard of you. Although I have heard of a doctor, is he from Ottawa? And I already forgot his name, but I recently subscribed to him. He teaches residents and does a lot of procedures, kind of like ours. Crazy Cat Lady, hi from Tulsa. And Mark Mary, hi doctor from Essex, England. Oh, that's really cool. We have somebody from across the pond. Allison Rose, good evening. Jennifer Lehman, I goofed. Laura Bills, hi there. Hi, Laura. Pamela Schramke, hello. So it's a couple minutes into it, and we'll go ahead and start to get into our discussion, which actually is from you. And Pamela, I see that you're from Indianapolis, and Audrey, you made it. Thank you. The title was Your Story. Tell me your story. We have so many stories that get shared with us from the viewers, the community of our channel. Yes, Jeff Butler. Thank you, BooBoo Kitty. That's who it was, from Toronto. Was it? Yeah, I think you told me about him. Allison Rose from South Carolina. Hadessa from Tennessee. So many people. Charlotte Embry, hi doc. So if somebody has a story of some kind of a medical experience, with a doctor, PA, nurse practitioner, something like that, go ahead and put it up, and we will talk about that, because this is your time to share your stories with the rest of us. And Cheryl likes Dr. Butler too, and Dr. Butler's channel's kind of like some other ones. You don't see a whole lot of Dr. Butler, don't see a lot about the patients. It's about the procedures more, and very procedural, very educational. Jennifer Lehman had 61 surgeries, only 51 years old. That's a story right there. 61 surgeries, only 51 years old. That's going under the knife more than once a year for your whole life. Emily Lawson, hello from Alabama. Hello, Emily from Alabama. We're glad to have you be a part of things. Anything else? If you guys have a story you want to share, you can. Oh, I was going to tell you what was unique about tomorrow's video, but I'll get back to that, because Pamela Schramke tells us, I have more medical issues that have the time for law. Pseudotumor cerebri is my biggest issue, lupus fibromyalgia, sadly. Invisible diseases, and those that have them aren't treated well. That's been the case a lot. I have hope that it's getting better, that people with these diseases, that there's not a definite test for to prove that they have it, but nonetheless they fit a pattern of symptoms and signs on examination that do fit with something going on in their body. And we know that's the case. A lot of these are mediated through the nervous system in ways that you can't necessarily see on imaging, or at least not with technology we have yet. Pamela, I appreciate what you are going through with that. And we also have other comments. I don't know, I'm going to keep up with them, but you guys can always do the super chat. I noticed that when Dr. Who's my friend? Dr. Thomas did the super chat, that it really worked well. So it is available. If I miss you, you can always use that. If not, I'll just keep going with the people I can. We try to keep up as best we can, but we want to keep things moving too. So we have Mark Mary, I was also born not breathing. Okay, so some people are born not breathing. That's a medical story. Reminds me of one of my most interesting procedures I did during residency. It's one of the few procedures that I've only done one time. and that was a newborn intubation. Baby was born, had trouble breathing, was not having good color, was not having good APGAR scores, was not having adequate respiratory effort, and so we put the tube in and bagged for a while until the color came back, pulse came up, baby was good, we were able to just pull it right back out. Audrey Bunch, watch a video on toe fungus. Doctor, if they had the toenail removed, wouldn't it be cured? Then the toenail grows back. Presto, all fixed. Sometimes that's the case. If they do get it early enough before the fungus has gone all the way to the nail matrix. Also, you have the danger of, and I'm aware there's a bad connection, those of you who are, well, I guess people are losing, I'm not able to speak with them. If the toenail goes all the way to the nail matrix, the skin where the nail comes out, the cells actually produce it, you can have some permanent problems there because it can damage it. But yeah, that would in fact work for some people's nails. That seems like a rather drastic measure to actually rip somebody's nail out of their body and then have them have to grow it back over the following 6 to 7 months. But yeah, that is an option. The reason I say it's kind of drastic is because a lot of people with nail fungus, they'll try a treatment, may or may not get success. And those who do not get success, I don't really encourage them to get real aggressive with it. The chances of having something bad happen from a nail fungus are very, very small. Very few people experience the infection spreading to their skin or something else like that, or anywhere else in the body for that matter. So a healthy person, very low risk. Now, I lost all your comments for a little bit there. I apologize that I was out. The number of viewers dropped down, but we're back. And yes, I did recycle my router before starting so that we would have minimum interruptions from connection issues. Okay, we do have the comments coming back now after that interruption. BooBoo Kitty, Dr. Gilmore did a double toenail removal today. Oh, lucky guy. Cheryl McNutt, Dr. John removes some far out toenails. You know, I haven't seen it yet, so thanks for letting me know about that one. Audrey, oh, okay, so that's it. We went straight from Audrey to Cheryl to BooBoo, and BooBoo's greeting Cheryl. And yes, we did lose the connection. We're back, and I apologize for that. Maybe I need to get a different ISP provider. Oh, there's only one that gives good service here, as is the case for a lot of the country, if you even have good internet service. Allison Rose, in spite of all this, I'm going to school to be a doctor. Good, Allison, I encourage you. Jennifer, have cystinuria, chronic kidney stone former since age 10. Oh my goodness, a little 10-year-old forming stones. Only familial match is my youngest brother. However, he also has the same disease. Oh my goodness, sorry. And Emily Lawson, pyeloplasty and PCNL. Hadassah, medical stories. I work in an ER. I have plenty of stories, except we're trying to get from the patient perspective. Hadassah. Jadens Garcia, hello, my doctor. I'm not sure what you're saying there, but we're just going to remove you. We'll just do that. Except it didn't remove it. Well, how about that? Will that work? Okay. Audrey, I watched that video today to Bad Ugly Toenails. Seth Rosen. What's the reason I would be allergic to all fresh fruit and vegetables? Well, I would say if it's all fresh fruit, all vegetables, it's probably not an allergy, but I'll let your allergist take it from there. And Mary, I do first aid with St. John. Oh, very good. And BooBoo says I need to get a new router. You may be right. Christopher Hopkins, hi, I watch your video a lot. Thank you, Christopher. Laura Bills, I took Lamictal over 10 years ago. One pill before they noticed signs of SJS. Is that Sjogren's? I'm not sure. And had my toenails fall out once a year thereafter. Didn't get drastic with it, and after a long time, it did clear up. Good. And Cheryl McNutt, talking to BooBoo. Lindsay, welcome. We are glad to have you here. And hey to you too. Jennifer Lehman had 30 operations on kidneys alone, and you only have 2 of them. Cheryl McNutt, hey Lindsay. That's amazing. 30 operations just on your kidneys. And I'm sure you already told me earlier what was going on with your kidneys because a lot of people are talking about different things. Oh, Stevens-Johnson's. Okay. Syndrome, SJS. Oh, what an awful disease. Stevens-Johnson's, where the body has this reaction to an infection and you get horrible rash. Immune system has to be calmed down with steroids. Can be very serious, can even be deadly. Lindsay, my lymph node is still swollen, by the way. Probably will be for a while, even if it's not something bad. Pamela wouldn't let me attach my question. It was recently discovered I have non-familial hypogammaglobulinemia. I guess my IVG is the worse off. Could lupus itself cause this? Any ideas? To have a hypogammaglobulinemia, of course, not being a rheumatologist, I couldn't say for sure, but I would not say that it's from the lupus. Although you certainly wonder if they'd be connected with two diseases like that in the same person. We always try to make things connected, you know. Emily Lawson, my right kidney was just huge stone. They had to break it. Was that when you were 10? I always forgot who was 10 when they had their first kidney stone. Armanita, just want to say you rocked. Oh, thank you, Armanita. That's very kind. Charlotte Embry, Stevens Johnson is horrible. Emily, staghorn calcification is, instead of having a nice round kidney stone, it's got, you know, weird shapes and things sticking out so that it can get stuck instead of passing. Kind of holds it up as it tries to go through the tube. Laura Clark, weird question. Have you ever heard of Gardner syndrome? I have, off the top of my head. I don't remember it. Cheryl McNutt, seems possible here. Pamela Schramke, what's strange is my rheumatologist wonders if my immune system attacking my actual immune system. Your immune system, so immune system attacking the immune system. Yes, that happens. Pamela, I was, say yay for the super, oh, there was a super chat? Did I miss a super chat? I'm not supposed to miss those. So if you get, oh, there it is, Pamela Schramke. Thank you, Pamela. I'm so sorry I zoomed right past that. I didn't see, I must have been talking so much. Hard to keep up with you guys. But Pamela, if you write something, I will be sure to look at that. Pamela Schramke. Okay, Pamela Schramke. And what is your picture there? It looks like some kind of little puppy dog, maybe? Okay. So we get, oh, okay, you were the one talking about, let me attach my question. Recently discovered I have non-familial hypogammaglobulinemia. For those of you who don't know, that means not producing enough of a type of protein that's needed for antibodies. I guess my IVG, or IgG probably, is worse off. That's a type of antibody that's used to fight off disease. Could lupus cause it? Treatment for lupus certainly could. And I'll see if Pamela had anything else a little further down, given that Pamela is our, there we go. What's strange is my rheumatologist wonders if my immune system attacking my action, and we talked about that. You can have antibodies against elements of the immune system. And lupus attacking my immune system itself. Yes, that can happen. Hopefully they can actually find if there's the antibodies for it. Oh, it's your pet skunk. Oh, you have a pet skunk? Really? Wow. We have been having so much skunk smell around here. And yes, I know somebody's going to ask, probably BooBoo. It's skunk, not skunk weed. In fact, Ethan has a video of one coming right up to him. He slept outside in his hammock one night and just walked right up. So yeah, we have skunks here. Do you have any problems with odor, I would ask? Or of course, maybe you don't know. Maybe just your friends know, and maybe they stopped telling you. Don't know. But I hear that they always have a bit of an odor, even if you try to fix them for that. By fix them, I don't mean neuter. Okay, I'm going to plug in, because this is a good one. A good live. So I'm going to turn this just for a moment so I can plug in some power. Good thing I brought it down. I brought it down just in case. Two pet skunks, Enzo and Remy. I hope I'm pronouncing that correct. Nash Guy 207, $2. Nash Guy, what do you have to share with us? I'm going to be looking for yours also now. And Pamela, they can't spray. Anal glands are removed. Okay. Do they still have that odor though, even with the glands gone? That's my question. Nash Guy, way to go. In the meantime, while Nash Guy's writing whatever he wants to talk about, we got Noor Fatima. Got thrombocytopenia, which means having a problem with the thrombocytes, specifically not enough of them, at 10, and had a bone marrow test to see if I was still making blood cells. Doctor said I wasn't going to make it since he didn't have signs of production. Somehow I'm still here. Yes, there's different types of thrombocytopenia. A couple popular ones, ITP and TTP. You've got thrombotic thrombocytopenic purpura, which is where purpura is referring to this rash of the blood just getting out into the tissues, kind of like a bruising of sorts. And then the other one, TTP, thrombotic, where you have clots and then bleeding, and then you've got ITP, thrombocytic, thrombocytopenic purpura. Oh my goodness, this is so embarrassing. Can't remember what the I stands for in ITP. But both of them, one of them is much more serious than the other, and quite often they respond to steroids for treatment. And I'm going to look back and see, because I don't, Nash guy, that's who it was. Nash guy 207. I just want to keep that in mind. Jennifer Lehman, when I was 10, had partial nephrectomy, meaning they removed one of the kidneys. Kidney is now atrophic. Dr. Eric gave to worry about neurosis of it, kidney. Pamela, a little. They can produce a musky, oh, you're talking about your skunk, akin to ferrets at times. Ferrets. Tammy Pearson, seasonal allergies here in the South. Any recommendations? Generally, I'm not quick to send people to the allergist to get their allergies addressed. What I usually do is what I see the allergists do after they do all their testing. So I'll be real honest here. The allergist will do testing. There's some serum tests that you can get done at the lab through the blood and avoid all the patch testing. The allergists, for whatever reason, are still doing the patch testing. Maybe it's because they see something in the literature that says that there's some superiority to it. Maybe it's because they get paid well for it. I don't know. I'm not up on the literature on that to answer that question. But those would be the questions I would ask. And they'll tell people what they're allergic to, and here's what happens. Either the person goes, yeah, I know, because every time I'm with my dog, I sneeze and my eyes puff up, okay? Or they say, no, that's not right. I can be around my dog all the time and it doesn't bother me at all. So either the testing is right or it's wrong. If it's right, or I mean, if it's right, then it just confirms what the person already knows. And if the person says it's wrong and they tell the patient to get rid of their dog they've loved all their life, and they don't, well, what good was the testing? So I've run into this pattern enough with patients getting allergy testing that I've become disillusioned with it in actual practice. And please, if somebody is an allergist, please correct me and tell me how it's so much better than my impression of it. I'd like to hear that. And so then they end up treating them for the symptoms because they're not avoiding the allergen, or they didn't have the allergen show up on the test. And they'll start out with something simple. If it's just nasal allergies, they'll do one of those over-the-counter steroid nasal sprays like Nasonex or Nasacort or Flonase or the generic of it. Those work very well, and you don't have to expose your entire body to antihistamine with those. And then if that's not working, they'll either add a different type of nasal medicine like a nasal antihistamine, or what's the other one called? Astelin, that works a little differently. Or they'll have them take an oral antihistamine. They also use a medicine called Montelukast. I can't remember the brand name for it, but it functions by modifying a different portion of the immune system. I think is it a leukotriene inhibitor, which is one of the chemicals that's released by the immune system when you're having an allergic reaction that causes all of the symptoms of it. And in severe allergies, steroids will play a role, but not on an ongoing basis. Okay, I don't think I missed any super chats while all that was going on. We'll jump in right where we're at here with Armanita saying, talking to Laura Bills. Okay, and Jennifer Lehman, do I need to worry about neurosis? Is it kidney? Neurosis in right kidney. This is the one, neurosis is referring to a person demonstrating neurotic behavior. Kidneys don't have psychological behaviors, so, you're probably talking about nephrosis would be my guess. Nephrosis, nephrotic syndrome, that means that the kidney is spilling protein, and that's a very serious situation that would be addressed by a nephrologist, trying to baby the kidneys by not letting it be exposed to unnecessary high blood pressure and high blood sugars if you're diabetic or pre-diabetic, and then sometimes surgical options or stenting if there's a problem in the blood vessels. If it's being caused by, like we were talking about, all these immune system problems, being caused by some kind of immune process, steroids. I'm not a kidney specialist, so I'm kind of going out on waters I'm not as sure of here, so I'm going to stop before I say anything that's not true. We have Charlotte Embry. Ashley Burrell is my best advice as a nurse to practice being very observant. It's amazing what you can discover before even speaking to the patient. Very good advice. Pamela, is there a way to send a message to another poster here? I see someone's daughter was just diagnosed with pseudotumor, and I'd love to talk to her. Well, that person may come back on and give you some kind of contact information. That's probably the way it's going to happen, because it would be very awkward for me to try to arrange something like that with what I have off the top of my head for different ways we might do it. Nash Guy question. Okay, I'm going back to Nash Guy. Nash Guy. Area almost passed out. My wife, who is RN and works in a cardiology office, called an ambulance, and I was rushed to the hospital at 11:30 a.m. Did tests all day. Did it around 7 p.m. And I'm thinking I missed something introduced. Oh, here we go. I have an interesting story. Back in November 2009, Saturday before Thanksgiving, got up that morning, felt we were putting up Christmas lights, and I got a strange feeling. Area almost passed out. My wife, okay, so you got some testing done. And, oh, this is such a cliffhanger, Nashka. Chest, did an echocardiogram. I had a huge aneurysm. Ooh, rushed me to surgery. Ended up being in surgery for 8+ hours. Replaced aortic valve and first 4 inches of your upper aorta. So the aorta and the aortic valve, that's the part of the heart where all the blood that's going to the whole body comes out. So it's a very important valve. And the aorta, the artery that comes out of, has this arch where it comes up, feeds the arms and the head, and then goes back down to feed the rest of the entire rest of the body. So it is a big deal what he went through to operate on that aortic valve that all the blood of your body is going through with each heartbeat, and that first part of the aortic arch there. So 4 inches of it. Wow. Yeah, those aneurysms can be absolutely disastrous, because if they rupture, if the pipe breaks, all of the body's circulation can leak out within just a short period of time. I'd like to tell you what that period of time is, but I'm not good at estimating things like that. I'm going to throw out the figure of 2 minutes, but I'll probably get eaten alive if I say something specific like that. Sutured, the rest of it also, aneurysm was so large it crushed 2 arteries, and they also had to do 2 bypasses. Dissected on the OR table just as they were hooking me up to the bypass machine. Dissection is where inside of the wall of the artery, you got a thickness to it here. Instead of bursting out the other side, it can leak into its own wall and shut off arteries that come off of the aorta. And so if it's the ascending aorta, it can actually shut off the blood supply to the carotid arteries going to the brain, or the arteries that go to the carotid arteries on the right. It is the carotid artery on the left. It can actually squeeze that as that blood is just surging through the layers of the aorta. If this is the tube and you've got the wall, curved, can you guys see that that's kind of curved there? And it splits the wall and all your blood goes into there. And if there's an artery coming off somewhere in there, in that wall, we'll say that's the artery coming off, say that's carotid artery coming off. Okay, no, I won't put my middle finger up like that. We'll use a different finger and we'll go a different direction. So if that artery is going through the layers, but the blood's going between the layers, it will actually compress that artery so that no blood can get through. And that's what happened to Nash Guy. Wow. Yeah, that could have been absolutely disastrous. And in fact, I have had patients come in with chest pain. It was their thoracic aorta dissecting, meaning that was happening where the blood was going between the layers. And they could not get them into surgery soon enough. They bled out into their chest, either on the transport to the hospital that was going to do the operation from us, or after arriving there. That was back when I was working in the emergency department in Roseville. Armanita, you're here. I hope it isn't a serious issue. Just not talking about for a few months. BooBoo, Cipher, keeping your mouth, save your gums. Wow, BooBoo, my goodness, what did I miss while I was talking? Oh, okay. Oh, it was the ascending aorta. Yeah, this guy was the descending aorta I was talking about. Somebody retracted a message. That was something. Nash Guy, you were the story of the night right there. Take huge doses of Diamox and Lasix daily to help pull off the excess CSF off my brain. Glad your daughter is only one of them. At least I'm having Okay, so this is people talking back and forth about the pseudotumor cerebri, where you have that excessive production of CSF that makes it seem like there's a tumor. That's why it's pseudotumor. It's not really a tumor. Cerebri referring to the cerebrum or the brain. Because of that pressure that comes from too much cerebrospinal fluid being produced, the fluid that bathes the brain. And those medicines help to limit that she takes. Armanita, I've been continuously losing weight by not taking my insulin, 60 pounds in 3 months. Then I had my A1C checked last night, 12 oh my goodness, no, Armanita, no. We need you to eat differently, unless you're a type 1, and then that's going to be very hard to treat, which your endocrinologist is going to be the one to help with that. All right, and we have very bad connection. So at this point, I don't even have indication that anybody's out there. Although, oh, Armanita, you're type 1. Wow, type 1 going off of your insulin and having hemoglobin A1C of 12.1. It's great that you can lose weight by getting off the insulin, but yeah, you're doing a lot of damage by doing that. If you can at all, through diet and exercise, control the blood sugar better, which you may not be able to if you're type 1, you have to. Your keeping from having a disabling stroke and heart attack is what it means. Nash guy, I'm having pain in my right hip and knee. How do I know it is sciatica? Difficult to say. Not something I would necessarily treat over the internet, but to just talk in generalities, there's some red flag symptoms that we look for to make sure it's not something bad with the spinal cord and spinal cord. And what you're concerned about are things like rapidly progressing weakness of the muscles, usually of one of the legs, problems being able to urinate, actual urinary retention, difficulty controlling the bowels, incontinence of stool, numbness in the saddle area, the perineum, the area between the thighs, between the genitals and the rectum, not able to feel touch there. Those are red flag symptoms that absolutely you need to be in the ER to get that addressed. It's a surgical emergency if that's happening. Short of that, it's something that can be taken care of on a more casual basis. Going to see your doctor, get evaluated for some other things like possibility of the bad things like a tumor in your spine or something like that. Usually it's not. Usually it's just sciatica treated with many exercises that you can find online for it. But I will not make a determination of what yours is over the internet because we don't practice medicine over YouTube. But those are some of my thoughts that I'd want you to be aware of. Hopefully it's helpful, even though it's not necessarily giving you a diagnosis for yourself. Nash, having any okay, that's good. Okay, those are the really bad things we want to make sure aren't there. There still can be bad things, but it's very unlikely. Your doctor would rule out things like a tumor in your spine or loss of blood supply to part of the spinal cord, which would essentially be a type of stroke, except instead of the brain, it's the spinal cord. These are rare things, rare as far as the big scheme of what causes people's back pain, but they're things that have to be ruled out, and that's why I always have the disclaimers. I can't practice medicine because there's always those things out there that I can't be sure they're not there over YouTube, but probably aren't. And Teresa Boring has lupus, a triple A, or maybe that was redundant. Blood pressure, arthritis, bursitis, bone spurs, all the hips. That's a lot of stuff to have going on. That is a lot of stuff. Jules Bejeweled, MRI will show soft tissues to see if your nerves are pinched, sciatica, but very unnecessary. When somebody comes in with sciatica, we don't get MRIs. We treat them with physical therapy because that will get rid of 80% of it after we've ruled out those red flag symptoms that would be a reason to go to MRI. And they get better without ever having to have their expense of going through an MRI, plus taking the MRI away from people who really need it. Nash guy, I know that, thanks. All right, good. Well, this has been a great evening. Thank you so much, guys. Thank you to Nash guy and to, who gave us the other what was it called? I can't. You guys are seeing me. It's too late for me. I can't come up with the word. But thank you so much, both of you, and thank you everybody for sharing your stories. This has been a great live YouTube. If any of you are able to, please tune in at 4 o'clock Pacific time tomorrow for the video. It really helps us to get promoted on YouTube if they see that a lot of people are watching it right when it comes out. Do keep commenting. Oh, yeah, the super chat with Pamela. Thank you, Pamela. You knew that it was you. So Pamela and Nash Guy, thank you so much. And we look forward to doing more of these in the future. I do try to make them kind of on the nights before we release the produced videos, which are Tuesdays and Fridays. So we're trying to do them kind of on Monday and Thursdays, sometime between 7 and 9 o'clock, which it is now. Now, of course, I don't take up the full 2 hours. I just, it's in that time that we do it. And half an hour is a good time to do one of these. It kind of depends on how things are going, whether they get extended longer or they're shorter. But you guys have been great. Thank you so much for making a wonderful YouTube. Do be sure to share this with friends that might be interested in medical topics. And if you somehow haven't already subscribed or turned on notifications, be sure to do that. And oh, and I should also let you guys know about Patreon. If you like seeing pictures that we take around the office or of cases or little videos of cases we don't necessarily put on YouTube, those are available to patrons on Patreon starting at just $1 a month. And we also have people who pay a lot more money, like BooBoo Kitty, Lindsay Graff, now Meg Lightbown, and Petra Rosenberg. So thank you all. Thank you all you ladies that are really doing a lot on there. And we will get back to, and BooBoo's telling you guys, Patreon's worth it. BooBoo gets to spend, she's the only one in her stratum. She's the only one that spends that Google Hangout with me monthly. It's just the two of us. So anybody else wants to join, there's room for more. Until next time, Dr. Mark Vaughan telling all of you wonderful viewers out there and members of the community and med heads, if you call yourselves that, we'll do it again another time. Until next time, Dr. Mark Vaughan telling you to stay in good health.